Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred. Joining us today on this episode is Wendy Couvillon, a nurse practitioner at Terrebonne General Pediatric Care. Thanks for joining us today, Wendy.
Thanks for having me.
All right, well, we're going to get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Great. So I've been a nurse for 30 years now, and I started off my nursing career here at Terrebonne General in pediatrics. I've been in the nursery, postpartum, women's health, and then after COVID, seeing how important practitioners were filling gaps, I really wanted to be able to reach people and provide a different level of care. Went back to school and was blessed to be able to join our pediatric clinic, and now I'm there and taking care of some of our littlest humans in Homa.
Oh, wonderful. And today we're going to be talking about Pediatrics 101. Why? Well, visits matter. So let's dive right into the conversation. So the first question is going to be, what is the difference between a well visit and a sick visit?
So well visits are meant to not just have disease prevention, but it's for health promotion. It allows us to follow these kiddos as they're growing from birth through their early childhood into their teenage years, and making sure that they're meeting all of their milestones, that they're growing appropriately nutrition-wise. It allows us to help parents anticipate what's coming next, making sure they're getting their vaccinations and their annual assessments. A sick visit, on the flip side, is a specific illness, problem, or concern that a parent has, and they're coming in for a diagnosis and a specific treatment. And it's more targeted to whatever that complaint is. It's not as comprehensive as a well visit.
And even though a child seems like they may be well, why are well visits so important?
Oh, we hear that a lot. My kid's healthy. I don't really think that they need to come in. So a well visit is more than just making sure there's no disease present. What a well visit does, it allows us to make sure, first of all, that the child is growing appropriately for height, for weight, that they're getting good nutrition, that they're up to date on vaccines. But it also lets us check for other things that parents, they see their kids every day. Sometimes the little things they don't realize are happening. Mm-hmm. So it lets us, at the beginning of a problem, start to intervene and get them resources or give the parents information and resources to help. And it could be from anything from a speech delay to weight gain or not enough weight gain to anxiety to other disease processes that let us stop it before it becomes a real problem.
How often should a child have a well visit?
So our littles, we see them quite often during those first 2 years because so much changes every month in a little one. Mm-hmm. But once they get to be about 3 years old, we're seeing them once a year. And at that yearly visit, we're checking not only their growth, their development, and then we're talking about safety issues and other things that are pertinent to that age group as they move forward.
So how are health issues detected at these well visits?
So that's great. There's a lot of different ways. So we do a lot of screening tools, hearing, vision, growth and development. Is your child walking? Are they talking? As they get older, are they having any issues with muscle tone and things like that? Other things that we're looking for, overall labs, we're looking, are they sleeping? How are they performing in school? Are they having social anxiety? Are they adjusting well to changes in life? So it's a complete physical, emotional, and mental profile of the child, working with the parent to make sure that all of the kids' needs are met. Sometimes, like I said, parents don't really pick up on it because it's so slow and insidious that an outsider can see it a little bit clearer.
That's very comprehensive.
It is.
So you mentioned it a little bit, but what milestones are definitely checked at these well visits?
So in our littles, we're looking to see, are they doing their gross motor skills? Are they sitting up when we expect them to? Are they rolling over, crawling, walking? We're looking for the range. There's not a specific date, but we're making sure that they're progressing like they should. We're looking at fine motors. Are they able to pick up things? Because that translates into being able to write with utensils, feed themselves, things like that. Mm-hmm. We're looking at speech. Are they communicating? We're screening for autism. Are they socially okay? Are they interacting with people? We're also looking for, as they get older, how are they adjusting to school? Do we have social anxiety? Are we having separation anxiety? Some of our teenagers have overall, just especially in the screen world that they have today, are having problems with focusing in school, sleep, things like that. So we're looking, depending on the age, a whole lot of variety of tools.
When you say littles, what age group are you talking about?
So we're talking about our newborns to our 2-year-olds. So we see them at at newborn, at 1 week, at 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2 years, 2.5, and 3 years. So we
Wow,
get to
you
know
get to
them
know
really well.
very much so.
Yeah.
What are some common concerns about development and growth do parents typically have?
So one of the things that's great about social media is we keep in touch. One of the bad things or challenges is we compare. And that's not just in us as adults. Parents, we hear this a lot. So-and-so's kid is already walking and my kid's 2 weeks older, they're not walking. Do I need to be worried? So reassuring parents that they're in the right time frame or not to be worried about what the other children are doing. We do that with our own children. My first one did this, but my second one's not. So that's usually a very big concern. The other concern we hear from parents a lot of times is just about overall growth. Are they eating well? Are they having the right nutrition? Are they getting as tall as they should be? Are they getting enough sleep? Just kind of getting some affirmation that the parameters they have at home are working for their kid.
Sometimes you really do question, especially if you're a first-time parent,
100%.
that,
100%.
okay, what is wrong with me? So getting the reassurance from the physician, the practitioner, makes you feel a lot better.
Yeah, and sometimes what works for your first kid is not going to work for the second or third child. So we get those parents that this worked so well last time, and just helping them find the right groove for the next child.
Right. Well, what role do vaccines play in well visits?
So one of the things that we have a lot of conversations, especially in today's world with parents, is vaccine safety and the reason for vaccines. Vaccines are about disease prevention. We have conversations with our parents about the schedules, about the recommendations for schedules, and what the alternatives these disease processes can look like. So especially in our younger children, our 4 and younger, there are several vaccines. And so vaccines we coordinate with well visits. So we're making sure they're developmentally okay. And those are usually a longer visit. So we can make sure we're having conversations with the parents to answer those questions.
That probably puts them at a lot of ease.
A lot, hopefully.
How can a parent prepare their child for upcoming vaccination?
Okay, so for the parents' role, make sure that they're visiting sites like American Academy of Pediatrics, Children's Hospital of Philadelphia, or CHOP, and making sure that they're getting familiar with what's coming up, what are possible side effects, and ways to prepare their child is to let their child know that they're not getting shots because it's a punishment or because they misbehaved. It's to help keep them healthy, and letting the child know, don't surprise them at the visit. You know, everything went great, then all of a sudden, surprise, you're getting shots. We usually encourage parents to have those conversations ahead of time, and come and prepare with questions too if they have them, so we can address them with the parents.
Right. Do you find there's any side effects with vaccines sometimes?
Biggest side effect that we usually see, honestly, is just soreness at the site. Just like if you get a shot, your arm, your leg is sore, and little ones can't tell you, a 6-month-old can't tell you. So just making sure parents are looking for the signs of that it's bothering them at the sites. But in 30 years, I've not had a vaccine injury, so been blessed.
That's wonderful. If their child gets behind on a vaccine, is it bad? I mean, can they just pick it up where they left off?
So it depends on why they got behind as to how we approach it. Maybe the child was really sick, had some respiratory issues, or was hospitalized for pneumonia or something, and so they fell off that grid. Best thing to do is meet with your provider, and there are the CDC and the American Academy of Pediatrics have a lot of catch-up schedules that help us plan the safest way to get them back on track. It's very easy. It just requires a conversation and some scheduling with your provider.
Okay, that's good to know. And for well visits, how can a parent prepare their child for a well visit?
So well visits don't have to be scary. I was saying earlier how much I enjoy well visits. We play. Let the parents know that they're going to come and they're going to interact with the provider to make sure everything's okay. As the children get older, encourage the children to ask any questions that they have as well. But well visits, we do things like stand like a flamingo to check for balance and hop like a kangaroo. So let the parents, let the kiddos know that it's going to be fun. It's going to be an interaction. We're going to have some fun to make sure that they're on track.
What are some common questions that parents ask during these well visits?
A lot of questions that we get, depending on the age group, are ways to help the parents approach possible problems they're having. We get a lot of questions about sleep routines, nutrition, picky eaters, or how do I fit in healthy snacks in a very busy schedule? My kid gets off of school, we're racing to practice. Chick-fil-A is the easiest thing. How do I eat healthy in that kind of lifestyle? What are good sleep routines? How do we increase activity? So we get a lot of questions like that, just parents needing information to make the best decisions for their children.
I know one main concern was like, my child doesn't eat anything. I mean, if they don't eat vegetables, I mean, is that okay? Are they going to grow? Are they going to,
right? And so when parents
develop?
come in, we talk about ways that you can hide vegetables in plain sight, cauliflower crust for pizzas, adding kale in a smoothie that they won't taste. So we talk with parents about ways they can be creative and just making sure the kiddos have all the things they need.
Sneak in the vegetables.
Sneaking in the vegetables if you have to, correct.
That's brilliant. So how does a well visit change from a little to more of an adolescent or child?
So when they're little, there's so many changes between each visit. We're looking to make sure that all of those changes that we expect are happening in motor skills, in speech, in interaction with others. As they get older, the growth and developmental skills don't change as much, but the emotional, mental do. So we're looking to make sure they're adjusting to school. We have conversations about peer pressure, about the dangers of vaping, tobacco, drug use. We prepare them for puberty. We answer a lot of questions about their changes as their sexuality progresses. Is this normal with my body? We talk about nutrition, sleep, safe screen time, internet safety. So the conversations with the kids start to morph more into how do we help them engage with the world in a safe way.
That's very comprehensive. I mean, I can remember when I, went to the doctor, it was just all, what's your temperature? What's your blood pressure? I mean, they didn't even get into all these things. I mean, are you finding that you need to cover a wide spectrum of social topics as well?
One of the things that I've found with my older peds patients is they're having those conversations. If they're not having them at home with mom and dad, which is the ideal place, and they're not having them with someone who's giving them the good information, they're having them on the internet or with friends who may not be giving them the right information. So there are a lot of times where I'll say, hey, do you have any questions? Vaping. What do you know about vaping? Oh, Miss Wendy, my mom already told me it's so bad. I'm never going to touch it. We have some kids who say, my friends say it's not bad. Okay, well, let's have a conversation about that.
Right.
So some parents their kids are so engaged and it's great. Some parents are trying out those conversations. They just need a neutral person to have those conversations with. And sometimes we just need to back up what mom and dad already said. But the other thing is that well visits build up relationships. And so when the kids have an issue, they can come talk to us. They know, hey, my pediatrician's a safe place.
Right, a safe haven. So what other safety tips do you give at well visits?
We do a lot of sports safety and water safety. In our area, we have water activities everywhere. So we do a lot of education starting from the time they're very little of what does water safety look like. And as they get older, reminding teens, it's not just about, hey, don't horseplay around a pool. It's also boat safety when you're with your friends and those kinds of things. We talk about sports safety, helmets, the right sports equipment, trampoline safety. Electric scooters are a big thing right now. So we're having to have conversations about road safety and what that looks like. So as they get older, the equipment and the safety speech changes a little bit, but the same idea of safety in water and sports mostly.
Very, very good. All right. One last question. Nutrition. Do you get a lot of questions about nutrition?
We do, mostly because we live in such a fast-paced society. We live in it's easier to pick up fast food on the way home. And so we get a lot of questions of what do my kids need? How do I get them all the things they need? What are healthy snacks? My kid doesn't eat lunch at school. So parents are gratefully having those conversations because gut health is so tied to overall health. And so luckily we're having those conversations, but nutrition is a very big discussion in a lot of our well visits.
Well, thank you so much for sharing all this helpful information and for educating our children about everything from health and socioeconomic features that they have to worry about.
Well, thank you so much for having me.
For more information about Terrebonne General Pediatric Care, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks for joining us.